The top of the hour, 19 minutes away. We are only 2 hours away now from several hours from the rollout of Obamacare. Some of those health insurance exchanges set to go live tomorrow. House Speaker John Boehner continues to warn that the law is simply not ready, while others in the administration insist that the rollout date is final and will not change.
Nobody knows what the rules are. Employers scared to death to hire new employees, cutting the hours of many of their current employees, and for what reason? This law is not ready for prime time.
I can tell you that on the operational front, we will be continuing to move forward on the Affordable Care Act, and we're less than 24 hours away from open enrollment in the new marketplace.
All right, now what about those new marketplaces? Brad Blakeman, former Deputy Assistant to President Bush, and Bernard Whitman, Democratic campaign consultant. Gentlemen, good morning to both of you.
Good morning.
Hello. Did I say good morning? That's force of habit from the other show. Good afternoon, gentlemen. Brad, I get the sense that this is a soft sell. Like, you know, you go into it easy, kind of a soft launch. Make sure there's no major glitches so that, you know, folks like us don't have much to talk about. Now, what is your sense about tomorrow, Tuesday?
No sale. I think, look, the president knows it's not ready for primetime, Bill, because he's delayed the employer mandate. They don't have to comply, yet individuals do. And when you ask individuals what are their obligations, they don't have a clue what their obligations are. They don't know where to go. They don't know how to enroll. They don't know what their liability is going to be. But they do know that their exchanges in many states are still undefined. Is it going to be the state? Is it going to be the federal government that's going to take over? Lawsuits are rampant all over the country as to obligations. So this is a bill that is certainly, as Speaker Boehner said, not ready for prime time. The American people don't know what their obligations are. How can they possibly enroll in something that they don't even know how to begin?
Gotcha. Bernard, is this going to be an embarrassment for Democrats?
I don't believe so. And Brad, you know, I like you, but you're basically just being Chicken Little. The sky is not falling. In fact, the Affordable Care Act has already demonstrated enormous benefits to over 100 million Americans who now don't have lifetime or annual caps, 85 million Americans who have got preventive care already under this law, probably saving tens of thousands of lives this year, 13 million Americans who now have coverage, who couldn't get coverage because of pre-existing conditions. And so what is tomorrow about? Tomorrow is an opportunity for the sort of first set of 25 or 30 million Americans to be able to get access to health care that they previously haven't had. In a lot of states, the Medicaid rolls of those people without health insurance is going to fall by more than half. And frankly, it's a beta. It is. It's a soft launch. And the real test is not going to be what happens tomorrow, but over the course of the next 6 months.
It'll be the next 6 months. You're right about that, Bernard.
Let's see how many people sign up.
You make a good point about that. But the measuring stick is high because the White House has put out numbers that they must meet. And so you're all going to be watching these barometers as we go forward in the coming months. But, Brad, you believe the law itself falls apart at the grassroots level. What do you mean by that?
Well, here's the problem, Bill. At the grassroots level, people don't know what their expectations are. More importantly, they don't know what their obligations are under the law, number one. Number two is this law is dependent upon millions and millions of young people signing up. Remember, Social Security, when it was founded, 7 people were paying in for every 1 recipient. They need those kind of numbers in order to make this health care available and quote-unquote affordable. I don't believe that's going to happen. And what you're going to see, I think, in the very near future is the youth saying we'd rather take the $95 penalty than to pay a $2,500 premium. And if you don't have the numbers paying into the system, we don't have the money available to pay out.
I can understand that. Bernard, what is your prediction on that, by the way? That's really important.
Well, yeah, but my prediction is ultimately what are we going to get out of this? We're going to get lower health care costs and higher quality of care. Why? Because this is forcing the health insurance companies and ultimately the providers of health care to compete. We have not had proper competition before. You've had
and a lot of Republicans want more competition. But come back to the question again. Young people need to buy in. Are you saying today that they will?
I think that, look, I think that people coming off their parents' health insurance probably won't buy in right away. I think there are a lot of young people in their 20s and 30s who are starting off with families who are absolutely going to buy into the system. It's going to take time. It's a 3-year phase-in to try to get all these 25 million people on board. And I think that those people who have Families who are married are probably more likely to. But I got to tell you, there's a lot of people in their late 20s and early 30s who are going to buy in.
If they do not buy in, Brad, the math doesn't add up.
It doesn't add up. And look, assuming everybody did buy in, which is not going to happen, there isn't the competition that Bernard talked about. There are big insurance companies who are absolutely leaving states like Virginia and New Jersey. They're saying it's too onerous for us to compete in these states, so we're opting out. There's no forcing by the government for these insurance companies to do business in those states. So the pool is shrinking, Bill. It is shrinking in states where now there are only 2 or 3 available options for health care, where the president promised us dozens.
If that's the case, then, gentlemen, and the math doesn't add up, whether it's 2 years from now or 5 years from now, there's only one way to cover that.
Hold on,
that's to raise taxes.
Come on.
Hang on, Bernard, is that the future of this law?
Well, first of all, no, it's not, because the assumption's incorrect. The fact is competition is there. Blue Cross just announced today that they're going to be offering over 150 healthcare products over 30 different states. And so companies that can't figure out how to compete, they are going to exit the market. That's what happens in a market-driven economy. New companies are going to come in. They're going to innovate. They're going to drive costs down. People are going to understand that they can get quality care at reasonable prices. People are going to join these exchanges, and there's not going to be another tax increase.
That's the case. Blakeman will come back on the air and say that you were right.
Of course he will.
Look, it's not going to happen, and here's why. The health care that we're already obligated to pay, Medicare, Medicaid, is going bust. If we can't even improve the health care we were obligated for decades, why is this new system going to work? It isn't.
Gentlemen, thank you. Bernard Whitman, Brad Blakeman. We set the bar low here, and now, Bernard, you're going a little high on us, okay? So
it's going to take some time, Bill.
Well, it may, and we're going to see whether or not it measures up. So, gentlemen, thanks to both of you.
Thanks, Bill.
All right, Allison.